Hi, this is Dr. Dures Feita Gayuna, your faculty for the 19th lecture in legal medicine, simply entitled Birth. Birth is the entire delivery of the child, with or without separation from the body of the mother. It is the cessation of the symbolic relation between mother and the fetus. The study of birth has legal importance. Birth determines personality. For civil purposes, the fetus is considered born if it is alive at the time it is completely delivered from the mother's womb. If the fetus is less than 7 months, it is not deemed born if it dies within 24 hours after its complete delivery from the maternal womb. In some instances, the appearance of a child may be grounds for revocation of a donation. And in case of infanticide, proof of live birth must first be shown by the prosecution. There are two types of birth that are of medico legal significance: stillbirth and live birth. Stillbirth is when the child has not breathed or has not shown any sign of life after being completely born. Stillbirth may be due to immaturity, congenital diseases with malformation, general debilitating diseases, or diseases of the degenerative organs. Intrapartum accidents or violence, whether deliberate, accidental, or death, may also cause stillbirth. Live birth would mean that the newborn child exhibited clear signs of vitality. In law, the presumption is that every newborn child found dead was born dead. The burden of proof now lies in those who declare otherwise. Proof of life at birth are: 1. The presence of a heart rate and blood pressure, crying or other form of movement, the presence of respiration. In the past, the Foderes test, or the hydrostatic or static test, or lung float test was performed during autopsy. It was one of the tests to determine whether respiration took place on a newborn child before death. The basis for the test was that the specific gravity of lungs becomes less once air is introduced into the air passages and air sacs. However, this is not considered fully conclusive. The stomach and intestine of a newborn who has been born alive would present with air bubbles admixed in saliva and mucus. Changes in the middle ear. The middle ear of the child before birth is filled with a gelatinous embryonic connective tissue. Redin's test shows the absence of this gelatinous material from the middle ear of the fetus, taken as evidence that a child has breathed and therefore had been born alive. Proof of length of survival after birth. Changes in the skin, such as vernix caseosa, present up to 2 days. When present, the caput succedaneum shows that a child was born with head presentation. There are color changes in the course of the absorption of this caput, from black to blue to green to yellow, until it disappears at about 7th day of life. Changes in the umbilical cord. The mummification of the cord does not occur if a child is submerged in water after birth. An already mummified cord, on the other hand, may again become soft after continuous soaking in water. The umbilical artery begins to contract at about 10 hours after birth. The umbilical vein and the ductus venosus obliterates on the fourth and fifth day, while the ductus arteriosus on the third day. The foramina vale closes on the second or the third month of life. Signs of maturity of a child at birth are the length of the fetus, his weight, disappearance of lanugo hair, plump or a robust body and limbs of the child, and the face is usually smooth with no wrinkles. Other signs of maturity of a child at birth are: the baby's skin is covered with vernix caseosa, the head is covered with hair, about sometimes 2 centimeters in length, their nails project from their fingers, and one of the or both testes are in the scrotum in the male, and the labia are closed at the vulva of the female. The lower end of the femur so ossification is about zero point 0.6 centimeters in diameter. Thank you for your kind attention. Do keep safe.